you don't have to be a BSN to work from home. So I'd say 80% of the jobs will take an ASN, associate's degree nurse, or even a diploma RN. So BSNs, sure, there are some jobs here and there. Like out of 10 jobs, there might be 2 that will say you must be a BSN. 2. The others might say we prefer a BSN. Preferred means nothing. I tell my nurses not to even look at the preferred section of the job. When the job says, what do you need, for this job? What's the required? Preferred, ignore it. So many times the ASNs will be like, oh, but it says BSN. I said, no. Lots of times it just says preferred.
Yeah, that's huge. I actually started with my ASN. And it was my hardest degree to get from my bachelor's or my master's was my associates. They jam-packed that degree.
Yeah,
yeah, I'm a huge proponent for associate's degrees, especially if it helps you get your foot through the door as a nurse and you can climb up or just stay where you are. So if there's not a like degree requirement, is there a certain amount of time that you need to work at the bedside for?
That was perfect. Thank you. Yes. Well, we tell the nurses that they have to have been a nurse at least 1 year, and they need patient-facing or bedside experience. So what patient-facing is, maybe they worked in a doctor's office, bedside just means bedside. The word bedside means, did you touch your patient? That's what it really means. When we say bedside experience, it doesn't mean you had to be in the hospital at the bedside. But I mean, if you were in the hospital at the bedside, that's great. We say 1 year bedside or patient-facing experience. Now, sure, if you have 2 or more years, it's better before, to get into these remote jobs. I don't usually let anyone take my course unless they've had 1 year of bedside and patient-facing experience in the USA. And so, yeah, many of the nurses will say, well, why does it say, oh, you need 3 or more years? And I say, well, some companies will say they want 3 or more years. Some will say 2. And once in a while, they'll say 1, or they don't say anything. They just, leave it open.
Yeah, thank you for clarifying. So, Marie, we unfortunately have to wrap this up, which is a bummer because I feel like I could go on for so long. So, thank you so much for taking the time out of your day and really breaking things down on such a basic understanding level. Thank you.
Can I say one more thing about the years of experience? Many people will say, well, why do I have to have, 1 year or more, or 2 years or more, whatever? It's because of malpractice. When you are a nurse and you are remote from home, even though you have a team you can call and they're on video or whatever, and you're not really alone, but you are alone. It's a matter of the hospitals, the facilities, they have to pay malpractice insurance on everyone. And the companies, these insurance companies, are not going to let them hire you if you haven't had any bedside experience. Because, I mean, really, you need more than a year to have decent theory and really do the 360 degree, hands-on. And you learn from other nurses as you work with them. But yeah, it's malpractice reasons. They say, no, that person, I don't care, if they were a nurse's aide for 1 million years, they have not worked 1 year at the bedside.
Yeah, so they don't know the role. Yeah. Thank you. I had no idea on that either. Great inside tip to leave us with.
Well, thank you for having me. I appreciate it.
Absolutely.